the process is simple. If you are an essential worker, which is essentially the same list as people who can send their children to school, then you can go onto the gov.uk website. If you're symptomatic and you need a test, or if somebody in your household has coronavirus symptoms, which means that you're having to isolate, you can then you log on, you give some of your details, they text you an appointment time, and then you can go and get the test. And we're also introducing a home testing service so that we can post the test to you at home. You can administer it yourself, do the swabbing, and give it to a courier who'll take it to our labs to get you your result. It's it just is all about making it as easy as possible for people to be able to get hold of tests.
How long typically do the results take to come through?
Well, most of them will come through in under in a day, and the large majority in 48 hours. But clearly that's critical. And the courier route, we're relying on the courier. I'm sure they'll do a brilliant job. But it is, it's a relatively fast turnaround. But that's a really important part of the process.
The newspapers and some television stations have had pictures of some of these testing sites that look rather empty. Why might that be?
Well, that's true. And it's because we've been building the capacity and building this IT system that we've launched this morning so that people can get the easy access. And now we're able to open it up. So I very much hope that we'll get the demand to use the capacity that we've built as we ramp up to 100,000 tests a day by the end of next week.
Oh, now you mentioned it, you see. Now, I didn't know whether you were going to mention it again, Mr. Hancock, because we've got 6 days to go. We've 6 days to go, Mr. Hancock. On Monday, what do you think the number should be? Because you'll be aware what it was yesterday.
I'm not going to give any interim targets. It's very tempting. But look, we got to 51,000 the day before yesterday, that I announced yesterday. That was 10,000 higher than the day before. It's going up by about 10,000 a day. We always planned it to go up more sharply at the end of the month, because at the start of the month we were building the systems, building this IT system, automating the processes, so that instead of every single test having to be done by hand, they're now done by amazing machines in laboratories in Cheshire and in Milton Keynes and in Glasgow. So we've been automating the process, and now we're on the ramp up. And as you say, we've had excess capacity. We've wanted more people to come forward, and now with this really super simple booking system, I hope more people can come forward and use the capacity that's available.
So if you were the manager and this was a half-time team talk to your team, you'd have them roughly where you want to be.
Yeah, I'd say there's a lot done, a lot more to do. And my team, what the main thing I'd be saying to them is, well done so far. Unbelievable effort. They've run more miles than David Beckham in this one. The team, private and public sector team, pulled together. Absolutely unbelievable team effort to get thus far. They've been working through the night. But they feel a real sense of mission, Nick, because testing is so important for getting Britain back on her feet. They feel a sense of mission.
And just think, next Wednesday night it'll be the Johnny Wilkinson moment. They'll drop the ball back from the scrum, and that 100,000, and your political reputation will be safe. All that matters is the substance, Nick. All that matters is the substance. All right, so turn to other matters. It is reported that the Prime Minister will be back at the controls on Monday. Is that right?
Well, look, that's a decision for him and his doctors, but he's much, much better. I was talking to him yesterday evening. He's on great form. He's raring to go, but of course he's got to talk to his doctors to make the final decision. And even as his health secretary, that isn't a discussion I'd get involved in.
Is the Boris bounce back?
Well, he's I would say he's back to his normal ebullient self.
That's good to hear. With the testings, there has been concern. How worried are you about what's called a false negative rate? And if you look at Italy, I understand that in some instances they test 2 or 3 times. Do you have concerns about that, Secretary of State?
Well, the tests are getting better and better because as the science improves. And so the rate of false negative, that's you take the test, you are actually positive, but it says you're negative. That rate has fallen quite a lot. So it is something that is something we keep our eye on, but we've got confidence in these tests.
And if we look at the lockdown, we're hearing, as you will know, from Scotland's First Minister, Nicola Sturgeon, they seem to be a little more advanced in exactly where they will be with lockdown. Why would Scotland be, it would appear, ahead of the game over the UK government?
Well, the Scottish document put out yesterday essentially follows the 5 tests that we set out last Thursday. The NHS shouldn't be overwhelmed, that we've got to have the operational procedures in place, that the number of people who sadly die each day needs to be consistently and significantly falling. We've set out 5 tests, and the Scottish government has broadly followed those 5 tests. And I think it's good that we're moving on as a UK, as a whole country, on this. But the truth is that it is too early, safely, to lift the lockdown measures. The number of deaths is lower, was lower yesterday than the day before, and that's good. But it is still too high, and it comes back to the testing as well. To be able to hold down this virus using testing and tracing, contact tracing for people who have it, we need to get the number of new cases much, much lower, and then we can then we can hold it down whilst releasing more of the social distancing measures. So I saw the Scottish document. I think it's really good that we're basically all basing it on the same principles.
If you will allow, and I sense you probably will, that Germany has dealt quite well with the crisis, it would appear, if the final federal parliament in Bremen agrees, the whole country will move to people having to wear masks if they're using public transport. Can you see a situation like that in the United Kingdom, Secretary of State?
Well, you're right that I do look at what the Germans have done, and I talk to my German counterpart a lot. On testing, the government position hasn't changed. We of course look at the scientific evidence that's presented to us all of the time.
You mean masks, Secretary of State?
On masks, specifically on this point about masks. Yeah. The science is as more information comes through, the science is constantly evolving, and what we do is always bear in mind that science and then take decisions. But as of today, the government position is unchanged.
But what would persuade you to be against it? Because surely it's got to offer some form of help, doesn't it?
Well, yeah, but the thing is that we've got to also make sure that people who really need the high-end surgical masks and the clinical masks get them. Right. And because it is absolutely clear that if you're working in a hospital, in a care home, then there's a need for a mask. And so we've got to make sure that is the top priority when the evidence around the use of masks by the general public, especially outdoors, is extremely weak.
So we haven't got enough top-end masks. Is that what I take from that?
That's not how I'm putting it. It's that we've got to make sure that they're prioritised, but also you've got to follow the evidence in terms of how effective mask wearing is.
I see. And are you concerned about the spike in other cases, such as you might have seen the story earlier this week, an increase in cancer cases as well?
Yes, I am. I'm concerned that people aren't coming forward for if they suspect that they might have a cancer, or if they have a suspected heart attack or stroke. Far fewer people are coming forward than in normal times. And the message is really clear, which is that if you have a suspected condition like that, life-threatening potentially, you should call your GP. And if you're told to go to hospital by your GP, then you must go to hospital. It does worry me that people are understandably cautious about going to hospital at this time, but they shouldn't be. If they're told by their medic, their GP, or by 111 they need to go to hospital, then they must, because we don't want missing the early diagnosis of cancer because people are worried about coming forward because of coronavirus.
Lastly, because I know I've got to let you go, there is anecdotal evidence that people are getting back on the road, Secretary of State, that they held the line, if you will, but now in some areas traffic is up to sort of 40% of what it once was. How concerned are you about that, and what is your message?
Well, my concern is that people follow the rules, and actually in very, very broad numbers, people are following the rules. And it's just so important. I know that I've said this before, but it's so important because we have flattened the curve, right? We're at the peak, but we don't want to go back to rising numbers and have a second peak. So people really should follow the rules.